What do you think is the most important thing we can do to help improve your health and your family's health in the next 1 to 3 years? So this is more short term. What's one or two of the most important things we can do?
That's going to change because of all the different work that's being done right now. But I know it's just really difficult for Lake County residents, a lot of Lake County residents, to actually have the free time to become involved and participate and create a healthy, thriving, community. I know that a lot of people are doing a lot of good work, a lot of the Rotary and all of that kind of thing. But how do we get just the average, everyday person to get involved and, participate?
Thank you. Community engagement.
Anyone else? She's walking around with it. It's your opportunity.
Don't be afraid.
We want to hear from you. Okay, we'll move on.
Oh, yes, my dear.
Here, go ahead. Hi, my name is Jackie Felber. I worked with Lake Family Resource Center for 5 years and have engaged with many of your agencies. So thank you for being here and all you do. During the time I worked with Lake Family, I taught nutrition classes, some stop smoking classes, a few health and education. I worked with the homeless. And one of the things that I noticed is with the homeless, I felt that maybe they could be, as you said, more involvement in their own healing practices. I really appreciate that house you're putting together. I really feel that amongst that community, there's not a lot of pride. They need to be able to do something. I saw a church one time that put together a housing project, and what they did was anybody that came in had to take part in some small way. They had like a little thrift store, and people worked, and they ironed, and they mended, and they recycled, and they helped in the kitchen, whatever. Just a community for them. Because we are a community, and by getting together, I think having the involvement with people within helps a lot. Anyway, thank you.
Thank you.
I honestly think they need more job opportunities.
Does anybody else agree with that?
I love Lake County, but sometimes I get really tired of my crazy, drunk, high neighbors and the way they act. And I want to know what's happening with I want to know what the hospitals are doing with mental health and how we can help my crazy friends get off the street and have a little better existence than they do now. Thank you for hearing me.
First, I'd like to thank each and every one of you for coming here and so much for your time. I think the work that you're doing is excellent. Thank you very much. So, several months ago, we had another meeting in this very room that was wall-to-wall packed. And the primary topic of discussion was a Dollar General opening up in Upper Lake, just down the street over there. And at the end of the meeting, there was a poll, how many people wanted the Dollar General, and every single person, how many people did not want the Dollar General, every single person raised their hand, and I think there was one person who was for it, who was also the manager of the Dollar General in Nice. So one of the reasons why people didn't want the Dollar General is because it creates a food desert where, when Dollar General opens up, it outcompetes many of the local shops that offer organic options and, sell healthier options. And so people very often will have to drive, miles and miles and miles away because all the local shops have closed down in order to find, just vegetables or even, organic options. So I think it's important that, we consider the Dollar General opening up here, is that an improvement to the health of the local community? And I think many people think it's not. So I'd like to hear your opinion on that, and what the current status is of the Dollar General that may or may not open up here in Upper Lake.
Let me answer his question. We're doing two things. Our supervisor is going to do his best to put it on the agenda to change the building ordinance, which will prevent the 8 more who want to come into Lake County from being approved right from the start. And secondly, when it appears on the agenda for the planning or the board of supervisors, I imagine we'll have enough people in there to make the walls bulge out, having to say their 3 minutes about what the situation is. And there are a couple of other things, and I'll send that out in a memo I mentioned earlier to the 500 people as an email.
Okay. So you'll send the update out by email?
Yes.
Okay, sounds good.
Can I go into that question, answer a little bit? Do we need to have...
So they'll pick you up.
Yeah, I wanted to make sure that all of you know that this is the mantra that I'm using. Do you realize that for the first time in human mankind, except for maybe the time of the plague, that the next generation is going to have a shorter lifespan than your generation? You're raising kids that are going to live shorter time life. Why? You already brought it up.
No veggies?
Yeah, it's obesity and the foods and all the other stuff. The environment's part of it, but the obesity is, for me, it's mental health is the number one priority. Actually, somebody called on the phone, but number 2 was obesity in the foods that we're eating.
Hi, I'm a resident here in Upper Lake, and to answer what do I feel is the most important thing we can do to help health is increase law enforcement and have resources for the homeless people that encamp under the overpass over here on Highway 20, in the bathrooms, in the parks, and in the Walnut Grove over there. And one special community member that we have here that has brain damage but may also be doing other kind of drugs, that punched 7 people in the face over there and has been jailed and come out. Safety here is very, very important. It takes an hour and a half for law enforcement to get there here if they come. So to me, the most important thing to improve our health and our family's health is to have proper law enforcement to address problems and proper resources. I work on the Citizens Patrol here. Love to be able to post and hang up signs that say if you're hungry, if you're scared, if you're pregnant and have nowhere to turn, these kinds of things. We don't have that here, and we need it. Thank
you. Pamela Nichols, Lake County. He said something that I wanted to say. I've been here about 9 months, and when I came here, no matter where I went, I saw all the beautiful things that the county and other surrounding counties had to offer. And so those had to do with parks and recs and places to go eat and rest. But I've never, no matter what restaurant you go in, you see this big tourist attraction with all the brochures. But when you come on board, you don't see all these fantastic programs. Like One Stop, you can tell people to go Google. I've met families here that don't have the ability to Google. And so with all of your services, it's like, whew, wow. But where's that one-stop place that people can go and pick up that pamphlet? It can't be at one place. It's got to be like the tourist attraction brochures, and Dairy Queen, everywhere that families go.
I can run it back over to her.
So I touched on this earlier. So Hope Rising is building a website. It should be up next month, actually, and it's a data hub and a resource hub for everyone in the community. So if you're looking for resources for our homeless population, or how to unite your community, or where can I get my next mammo, you can find all that information on Hope Rising's website. So.
We also have the...
Do you guys have a phone? Do you think that phones? Okay.
What about the post office?
Yeah, we can put... Yeah, great. So I find that our homeless population is incredibly resourceful, and oftentimes if you don't have a computer at home, a smartphone. And this website is smartphone compatible, so you can pull up the information on your phone. You don't have to be sitting in a library or at a coffee house to see this. But this is good information about getting the information out? Like, where would the information serve your community best?
I would also say that the Health Leadership Network is working to put together a hard copy resource guide. They go out of date very quickly, right? Because a lot of programs are grant funded, things come, things go. So keeping things on the web is definitely the best way to keep everything accurate. But we will be, the Health Leadership Network is putting together something that's a hard copy updated on the regular, but the web is going to be the best source of information for sure.
Posting them then at the post office, and just so it's only one sheet of paper and you're not like sending out flyers. One piece that has the most up-to-date information.
It's a great idea. Do you want to, let's
get you on the microphone. That way people online can't hear you though.
Oh, okay.
Yeah.
The other thing too, though, is the payphone here was taken out, and I've had someone come in my shop trying to make a phone call, doesn't have a cell phone, and had no way to make a call, and needed some help. So I don't know how to do that, but
Thank you for bringing it up, though. Well, I don't know.
yeah, okay, thank you.
I saw a hand back over here. Oh, go ahead. Okay. And then we'll get Madam in blue back there.
I know I complained I was answering all the questions myself in the other forums, and here I am jumping in because I just can't resist. But Allison mentioned earlier at the start of the presentation today that we're in the midst of doing a community health needs assessment, and that's part of why we're here sitting with you guys today too. But we've identified a few preliminary priorities, and one of those priorities that she mentioned was helping find ways to connect our community to the resources that are available, which is what we're talking about here. So I love this discussion. I've spent a lot of time thinking about this as well. And as another partial answer to your question, I've noticed that we as a community, as a county, we do a lot of things, we do a lot of events to help people access services. For example, we got 2 great booths in the back here tonight, to help provide access to a handful of services. We hold, we have booths all over the place at community events. I was at the Cinco de Mayo thing in downtown Lakeport the other day, and there was a ton of great health services resource booths there. And so we put a ton of energy into getting this out at events, and I think we do a great job of capturing those people who attend events. But I don't think that's the majority of the population. And so I do think this is a question we need to think more broadly about. How do we capture the people who maybe aren't on the internet a lot, aren't coming out to events, aren't participating in the various avenues that we have thought of in the past. I think that's a challenge for us at this table, and it's a challenge for you guys too. And I'm appreciative that we're having this discussion today, because what is the right answer for them? There's some subset of our population that just, for whatever reason, doesn't interact in the same fashion that many others do. And how can we capture them? It's a very difficult question.
Dan,
I don't have the right answer to yet.
responsible for getting that out is Dan standing there and the Silver Foundation.
She's happy.
Choose it,
I will say though, we've identified this as a priority to work on internally within our group.
Thank you. I'd like to speak to the older population that we have, great numbers of around the lake. And I think that isolation and this is what we were talking about, a senior helps an isolated individual with a pet to make that connectedness. And, I think that our senior centers are doing a great job of getting out to the communities, but there's so much more to do. And I appreciate the fact that CalFresh is now opened up to seniors, and we are handing out applications for our Lake Senior Center. But we have a lot going on there and would like to increase our numbers of participants. And the participants that we can't actually get physically there, we're communicating with. So I think looking at the older population is something that we need to do to provide for maybe transportation and just a myriad of things that they do need and require. And we're doing all that we can, and we would like to do more because our older population is great in number and they are living longer. So we have I think, a real duty to do all that we can for them and reach them.
If I could just talk to her comments, I assume you're with the Senior Center here in Upper Lake. I'd very much like to talk with you offline, maybe after this meeting. One of the things that I had reached out to the Senior Center in Middletown, Clear Lake Oaks, and then spoke with Betsy in Lucerne. The three things that seem to be pretty common within the seniors and their needs is transportation, better food services, better nutritional options, and financial help in providing those options. So one of the things we had talked about is how can we get better transportation services to pick people up to get them to the center, then focusing on their dietary needs and also programs. So what I'm curious to know is if your Meals on Wheels program, can we communicate with some folks that are shut in, that are seniors, that are not able to possibly get transportation, they don't have their own vehicles? Can we use that as a medium for communication of different programs that might be available on the PEG channel? I'm looking at mobility programs, exercise programs that they can do at home. If they're in a chair or not able to move very well, these are things that we might be able to offer through that medium. So I'd like to talk to people or hear your input maybe in this question and answer session. Thank you.
One grand start is what the Silver Foundation, Jim Steele, started on the annual fair, health fair, to reach as many people as possible. We had twice as many this year as last year. It's a good start.
Okay, I guess you said pretty much from what I heard what I was going to say, and Russ, that was a good synopsis. No, actually, it's excellent. And Claudine hit it right on the head. We were trying to find the gaps, the fundamentals. Really, what's wrong with what we're doing? Are we heading in the right direction? What's right with what we're doing? Are we heading in the right direction? But it's all about the right direction simply because from our standpoint, just looking at seniors, we had to pick a population. I'm a senior, Gene's a senior, all of our board members were saying, look, let's look at the standpoint that the Native Americans had. They look at 7 generations back to look forward 7 generations, see if we're doing the right thing. We picked up on that, and we did a 1-year stand down. In that stand down, we call it the Senior Summit. We try to invite in booths of caregivers, providers, so the seniors can interface with them. We have a free lunch. That's what gets them there. We ask them, instead of the free lunch, or before your free lunch, there is no free lunch, you have to do a survey, tell us what it is that really seniors need. So we have those surveys, and that kind of guides our direction forward. So there has to be some incentive. And the thing we found was, by asking the questions, what do seniors need, rather than what do you as a senior need, we got a completely different type of answer, and it was a better answer. And one thing that we have seen around the county is that seniors want to be recognized for being a senior of a wiser, older person, and they don't want to be left behind. They don't want to be isolated. They want to still, and you have to find a way to reach them in their individual situation. If you were to look at the North Shore here, you would see ground center of the older population for a lot of issues that older population people have compared to the rest of the county. It's really centered here when we had all of the fires, and I was the supervisor here, and a lot of people were left behind. Everybody was supposed to be evacuated. I found folks poked in around homes all over the North Shore that could not leave and didn't want to leave because they found no way to leave anywhere else and preserve or to come back to what the situation where they were. And that was really an eye-opener for me. Prior to that, we had other eye-openers all the way back to the Valley Fire, and we've actually had 8 fire emergency, and it kind of brought forward the safety issue that I heard someone talk about. We do have a safety issue in their home. Fire is now creating a new crisis in their mind. We have a crisis of safety from the standpoint of drugs being dealt with in the communities here. At one time, of course, there were grows in everybody's backyards, the only way they could make a living. Now we've tried a different approach towards the cannabis issue in the county. There's also the issue of their welfare where they are. Something has to come to them. They can't go to that. So all of those things started to come up. And you were talking about people have, an iPhone. No, they don't. They don't even have a landline in some respects. And those that have a landline, those landlines are going away. That's going to be their future. So there is that loss of futurism, and so we tried to address that. From our standpoint in the Lake County Silver Foundation, which Jean is on the board member and so is Claudine, from our standpoint, we're looking at the quality of life as what gives them meaning so that they will then participate and seek all of the things that you're talking about. There is a hopelessness here. And we think we can do that by looking at that quality. We got all the surveys back. There's things that can happen. The senior centers, I think, have to be rejuvenated. Thinking about the last generation of seniors who are phasing out. They're not thinking about the new generation that's coming on that are either longer, they're going to live differently, or they're going to have different backgrounds. They have to make that shift. You have to find out a way to get that information to them. They're telling us they need exercise programs. You've already addressed that. They need that in a big way. They need to have the transportation. I'm on a new transportation board that's starting to be formed, and we're looking at how to get seniors to those things, how to get people that are shut in. You do have to have transportation because of the type of county we have. This is an intercoastal range county. It's landlocked in a way because of its mountains from everything else that goes on. These are folks that are kind of left behind. The generation has changed. They're left there to find a way to actually stay involved. So with all of that, there is a real challenge and there's real chances for improvement. And that's the thing that we have found out with these surveys and by interacting with these people. But what we realized was there was a lot of information that was not being collected in a way that actually was meaningful. Why we did this annual summit. And the last one was very successful. I thought it was 350 people. They had a free lunch. They had a good time. 10 people got awards for being inspirational seniors. And there is a key. If you're going to solve your senior issue for going forward when it's growing, you get seniors involved in solving their own problem. There's a lot of people that have to be engaged in solving that problem. And they feel they're retired and they don't want to get caught up in. You have to entice them, bring them in, and you have to get them in a way that they feel useful and valued. And so that's really the trick that, as we say, is humbly so because we just got involved in this. And I really appreciate the good work that everybody's doing and a lot of good friends here and people that I was associated with. I just can't applaud you enough. But I really believe that there are individual cases that still are lost to us, and that's what we're trying to find. So thank you very much.
So my question for you, I apologize for not being here when the meeting started, but I know that KPFZ played a huge role in reaching folks during the fires. I would love for us to have some support for KPFZ to be able to keep that radio station going. It's a complete not-for-profit. I don't know how many of you have ever listened to it. It has a whole array of different genres and different political attitudes and talk, and it really is seniors, from what I have experienced, almost always have a radio on. If you've got a radio on and you're listening to KPFZ, you're going to learn something. It might not be what you want to learn, but you're going to hear something. And if you don't like that, turn it to something else. And then in an hour or two, there's going to be somebody new on there. But it would be really great. And I think it would be one way that we could make this county healthier and safer by having a non-government or non-corporate radio station available to all of the people in Lake County for free. There is absolutely no advertising on there. You don't get the corporate input. They have a board. Everybody gets to go and attend their meetings. If you don't like what's on there, you have a way to have input into it. I just think that having a generator up there on Mount Konocti that would keep the radio station going during times of fire or flood or natural disaster of any kind would be good, and one of those safety issues that would be good for all of us to have.
So just one quick comment up on Mount Konocti, we actually do have a generator. It's a backup generator. There's power and a backup generator, so yes.
Yeah, I came here from San Francisco in perfectly good health. I was here on October 2010. Within a few months, I was working in a garden and got desperately ill, and I was treated at Sutter Hospital. The care they gave me made me twice as sick and made my sickness much longer. And I tried and tried and tried to get the doctor to give me a surgeon I could go to get surgery. She wouldn't do it. I had to go to another doctor. And because of that, my first 6 years here, I had to have another surgery. And so I had 2 surgeries in 6 years. 4 years out of those 6 years, I was bedridden in excruciating pain. I've been an artist my whole life. I've been a singer. I've lived in New York, San Francisco, Japan, Seattle. But I have spent all my life up here, sick and alone. And I've ended up being totally isolated from everybody. The only reason I knew about this meeting was because of my friend over there. She gave me the little tiny brochure. So how do I communicate with you and find out what's going on in this town when I'm living alone with no one to talk to?
Well, first of all, I'm so sorry for your health issues, and I'm glad and happy that you came out to talk with us. And thank you to your friend for doing that and giving that information. So I guess the question is what's the best way for you to receive information?
Yes, because other than her, I wouldn't even known about this meeting. How do I find out about stuff?
So are you online? Do you have a phone?
I have a computer, but I wouldn't even know where to look.
Okay. How about mail? Does that work? Or do you read the paper or listen to...
No, we can't afford the paper.
Okay, KPFC?
Oh, no, I don't listen
radio?
to the radio, no.
Okay. So it sounds like mail. Do you have a senior center that you go to?
Yeah, the senior center here, once in a while.
So that is one of our things that we're going to work more on, is getting information to the senior centers so that they can help disperse that out through their Meals on Wheels programs and to the seniors that go there.
Yeah, because even the Meals on Wheels store advertises their list of lunches and things. But if you had advertisement in the stores, I think that would help a lot of people who otherwise, I think you could fill this place up if you had better communication with advertising. Because there's no way for me to know unless I see something in print. I mean, even the laundry. I go to do laundry. I read the things on the wall there. If you put something up there, you would give people information who otherwise don't know. It would really be very helpful.
I completely hear you, and that is something we're going to work on.
Okay, great. Thank you.
Thank you.
Can I also...
Absolutely, Dan. Go ahead.
Just say, allow me to apologize for what you went through years ago. I'm sorry to hear that. I'd love to talk more with you afterwards about that, if that's okay.
Yes, because I was pretty angry what happened to me.
Yeah, I am very sorry to hear that. My expectation is, if you come in today, your care would be excellent and very different from what you're describing years ago.
Yeah, because I have some horror stories to tell you.
Yeah, so I'd love to speak with you about them.
Okay,
honestly,
great.
See what we can learn.
Thank you.
Statistically speaking, our care truly is very good today. Our patient outcomes are some of the best in the entire state.
That's great to hear. It really gives me a sense of hope.
Yeah.
Thank you.
But I'll look for you afterwards.
Great. So more questions on our healthcare system.
Can I just mention something?
Yeah, absolutely.
I missed your first name. Janice. Janice, you bring up a really great point. So, we get really excited when we all meet and we have these great ideas and we are trying to pull down funds for projects that we see that are out there that we need to be taking care of. We identify it, we recognize it, and this is the first step for us to really engage the community, because without these kinds of stories and without this kind of information, we know what we see you in the office, but we don't know your isolation necessarily or those kinds of things. And so this is exactly what we're looking for, is this kind of information to take back and then in all of our energies, put it in the right place. And so I really appreciate you coming forward and saying that. This is exactly what we're looking for. I'm writing like crazy right now, so thank you.
One of our priority areas is outreach and engagement.
Yes.
Yeah, as Elise just said, one of our priority areas for the next 3 years is outreach. So that is something we're really going to concentrate on.
I agree. Hearing personal stories is incredibly powerful. All right, we have a question.
Another question?
I've been taking notes as I sat here and listening to everything, both your comments and also from the public. My name is Anna Ravenwood. I've lived in Lake County for 20 years. So I appreciate, first of all, that you're offering the forum. This is good. So offering health and wellness information and your hard work and obvious collaboration is very good to hear, particularly after the news that we came in 58 out of 58 California counties. This question really goes to the last question where you asked about improvements over the next 3 years. I'd like to give you my thoughts on how to improve public health in our county, and it comes down to more money. We need a dramatic increase in grants and permanent funding from our federal and state level of governments. Thereafter, if needed, we need to increase local taxes to fund the Lake County Department of Public Health. After all, this is our health we're talking about. More federal and state funding would allow more Lake County Public Health Department staffing for outreach, communication, mental health assistance, more vaccinations, which could be provided by county staff because they can only do it for a few hours a week. More conferences on public health awareness locally, and more health services for our Lake County public school students. In short, we need to establish a larger and local paid staff within our county level to provide the public services and communication we need to improve our health. What brought me here tonight was reading once again that we are last on the list out of 58 counties, and what hit me, the word that came up for me was embarrassing. I am embarrassed. Now, you are all doing some very hard work to try to get us up out of that level, and I deeply appreciate that. But I don't think we can do it without more money. We can be much, much, much more effective if we hire the people to help you get the word out. Thank you.
Thank you very much. Allison, did you want to say something?
So I just want to say one of the benefits of having a coalition like Hope Rising is when you apply for state and federal grants, if they see that you're operating in a coalition and that there's a nonprofit applying with you for a grant, as well as public health, as well as a healthcare agency, it puts you in a pool to receive a higher amount of funds, and that's exactly what we're doing. So I just thought I'd let you know.
Dr. Gustafson, do you want to comment on any of that from public health?
I think with our new governor, there's been more of an emphasis on funding for public health. For example, there's proposed $40 million for communicable disease investigations that we have written a letter of support for through public health, and so hopefully with this new emphasis we'll have more funding coming along.
Great question.
This is long-term, but the new governor is also highly investing in young children and families. And we are seeing more money than we've ever seen come through for early intervention and prevention at that age. There's $60 million in funding coming down for, I mentioned at the beginning, adverse childhood experiences and how much those contribute to the way our brain forms and then the way our bodies respond to stress later in life and all these health outcomes that occur. And he's funding screening for that in children for every child participating in Medi-Cal, which is half of our county's children, as well as $60 million for developmental screenings, which we have grassroots organization way of approaching that here in Lake County. Our pediatricians screen for developmental delays. We screen in the playrooms. We screen through early childhood education. If kids are in preschool and they're enrolled in the quality rating and improvement system through Lake County Office of Education, they get screened. But it's an informal system, and some of the things he's doing are going to make that a very logical, informed decision system statewide, where there won't be any gaps for kids to fall through. It's exciting to me to see the potential there, particularly, but it is a longer term investment, but it's a very high return on investment when we invest early like that, so.
And those are really great comments, and thank you for your statement and your comments. In addition, the 3 county departments, the health department, behavioral health, and DSS, are collectively working to collaborate more on grants that can go across agencies. So we are looking to draw down those higher dollars, and both hospitals contribute a lot of dollars back into our communities through programs that they're working on in their facilities and their agencies. So I don't know if either one of those want to comment on some of those, but everyone has really stepped up to try to do everything we possibly can. We see the need is here, and we're going to do everything we can to make a path to be better, because we're not 58. We have so much more to offer than that number.
The percentage of improvements in some categories, and make certain that it's put into the editorial once a month, where we can read about health, where we can hear what you've done, where we know where your goals are, how you're going about reaching them, but put the news into our hands so that we don't have to come to these, but that we get to have an interaction and talk to our physicians or our lab techs as you're presenting what you're doing month to month, and choose groups or choose your network, but talk about them and have them print more for the public viewing of what's being done.
Really great suggestion. The health department just last month produced their first newsletter, which will start going out quarterly. Am I saying that wrong? Quarterly. Also, we have some coalitions. The health coalitions are putting out newsletters. So we'll make sure that those get out into the media more and into the newspapers more. But we are starting to work on that. I know the county puts out a newsletter or a message. Is that correct? Is that just to county employees? Yeah, okay. So I'm mistaken there. Thank you, Supervisor Scott, for correction. The hospitals and the clinics, what do you guys do?
We do articles in the Record Bee fairly regularly on the things that we're doing. I think what we all struggle with up here is what's the correct medium to use, or which ones to use, because you say an editorial in the paper, this lady's saying, well, I don't get the paper, How do we reach everyone? That's what we struggle with. Yeah, and so we do, and we've talked about even this, we put some ads out for this or not ads, but we went on the public radio station to get the word out about this. It's just very difficult to reach everyone. I agree, we can do more in all of these categories, but there's really a lot, and to hit everyone,
Of information is what we're doing right now. We're outputting information so that we can take it in and utilize it and give it to our students and our neighbors and our loved ones. I agree with all that. If we start somewhere and we consistently keep it up, it will be better than what we're doing today.
Well, we have a marketing program at Adventist Health Clear Lake, and I also want to echo, that we recognize that is one of our 3 priorities for this coming year that Allison pointed out. We've publicized, 94.1% of our clinic patients would recommend their provider to a friend. We're in the 73rd percentile for patient experience scores, 0 hospital infection. All these things have come out, and we've advertised this on social media, Facebook, and other mediums. It's been in Lake Co News. I believe it's even hit Record Bee, but still it isn't. You're saying that you're not seeing it. So we need your help. That's why I'm glad we're here. We're having this exchange. Are there other mediums that we're missing? Maybe the bulletin boards at the laundromats, other things that we might be able to pull together. I don't know, but we're looking for that data. So if you have suggestions, I'm happy to listen to them.
You know, I wanted to mention, we recognize the frustration. This is the exact thing that we've been looking to try and bridge. And by identifying community champions who maybe engage with us, that's not the only answer, but engage with Hope Rising, and then with the website ultimately becoming a one-stop for all information as to what we're pushing out, as well as then the community engagement, our constant outreach to these kinds of forums. I think in the months and the years to come, this will be a packed house. We'll be at your Seropolis meeting. We'll be at the Rotary. Someone who are from those agencies will be coming to a Hope Rising meeting, and there'll be this free flow of all good things that are happening and great information coming to us as well. There's my rainbow and butterflies.
Thank you, Kim.